Hi, good afternoon, everyone. I would like to thank to every and each one of you for being here with us at this live session from MAHSA University Saujana Putra campus. I am Siti Aisyah Munira, lecturer from Medical Imaging Department from Faculty of Health Sciences, Nursing and Education, FOHSNE, MAHSA University, and I will be moderating today's session. Today's webinar, Exploring Modalities in Medical Imaging, Innovation and Applications, is proudly organized by the Faculty of Health Sciences, Nursing and Education, MAHSA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by Faculty of Health Sciences, Nursing and Education, MAHSA University. Alright, so under Faculty of Health Sciences, Nursing and Education, we have several schools and departments. School, for example, School of Education, School of Physiotherapy, Department of Environmental Health, Department of Medical Imaging, as well as School of Nursing. Program offers under each of the school and department. For School of Physiotherapy, we offer Diploma in Physiotherapy, Bachelor in Physiotherapy Honours, both in the full-time mode and also ODL, as well as Master of Physiotherapy. Under Department of Environmental Health, we offered Diploma in Environmental Health, Bachelor of Environmental Health and Safety Honours for the full-time and also ODL mode, as well as Diploma in Occupational Safety and Health. Under Department of Medical Imaging, we offered Medical of Imaging Radiography, Bachelor of Medical Imaging Honours, full-time as well as ODL mode. Okay, why need to join health sciences? Okay, the first one is high job demand. For example, the essential services. No boring work routine as daily we experience different experience and challenges at the work. Lucrative remuneration. Low risk of job redundancy, which job cannot be automated, so need for the healthcare personnel. Opportunity to work in variety of setting, not only in the hospital or clinical setting, and it also a career that can you feel good about it. Okay, next is the entry requirement. Okay, under Master of Physiotherapy, we offer two types of the program: 1 year program, which is a full-time, or 2 year program, which is a part-time. So these are the entry requirement for the Master of Physiotherapy, need for the bachelor degree, and also need for the English proficiency for international students. For all the bachelors in, for example, Bachelor of Physiotherapy, Environmental Health and Safety, and Bachelor in Medical Imaging, these are the entry requirements. Need for the matriculation, pre-university as DPM, A-level as well as diploma qualification. For Diploma in Physiotherapy, Environmental Health and Medical Imaging, these are the entry requirement. Need for the SPM qualification, DCE O-level qualification, as well as the certificate. Last is for Diploma in Occupational Safety and Health, which is a 3-year program. So the entry requirement need for the SPM, O-level, and certificate. So MAHSA University and Infinite Excellence is what MAHSA aspires to provide to each of its graduates. So why choose Faculty of Health Sciences, Nursing and Education MAHSA? First, because we have experienced and dedicated international pool of the academic staff, both local staff and international staff, to teach and assist students in the learning field. And we offer various of the study modes, not only in the conventional, also in the open and distance learning. We have cross-teaching experts with the health discipline in one single institution by the IPTS. We also have the interactive teaching emphasized on the hands-on clinical skill, both in face-to-face and online platform LMS. So wide list of the hospital institution for the clinical and industry placement, and the programs offered by our faculty is accredited by the MQA and JPA with the international recognition. For example, we have dual award with the ARU. To assist the needy student and those students who are eligible for the scholarship, MAHSA offer several numbers of the scholarships. For example, Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teachers Scholarship, Family Scholarship, as well as the Single Parent Scholarship. So collaboration and affiliation help to enhance the student teaching and learning. So we collab with the various regulatory body. For example, World Confederation for Physical Therapy, Malaysian Society of the Radiographer, and with a various number of the universities. Not only that, to expose students with a new culture and knowledge about diverse community around the world, we also have the student mobility program. For example, here we collab with the Soci University, the University Lovely Professional University in the India, as well as the University Sriwijaya at Indonesia. So with that, we welcome you to join us. Please contact us through MAHSA website or through our faculty Facebook page to know more about our programs, or simply leave comments. We will get back to you. Your question concerning this webinar session can be listed in the chat box. Okay. Dear viewers, regarding our webinar topic for today, which is medical imaging. So let me introduce you to medical imaging. Medical imaging refers to the several different technologies that are used to view human body in order to diagnose, monitor, or treat medical condition. Each type of the technology gives different information about the area of the body being studied or treated, which is related to the disease or injury, or showing the effectiveness of medical treatment. Thus, this webinar will explore the range of available modalities and outline the different principles and technologies used by each of the modality. So, the uniqueness, advantages, and clinical application also will be discussed in this webinar. So, without further ado, let me introduce to our speaker today, Madam Umi Sarah Zulkifli. Hi, good afternoon, Madam Umi. How are you?
Hi, Miss Munira.
Are you excited for today's webinar?
I'm very excited to present
All right, great, Madam Umi. So before that, let me introduce a little bit background of Madam Umi Sarah. She holds a Bachelor of Health Sciences Medical Radiation from University Science Malaysia. She has been a core member of academic team in MAHSA since 2007. Quite a long period of experience. So without further ado, Madam Umi, I will give the screen to you. So the screen is all yours.
Okay, thank you, Miss Munira, with the warm introduction, and I'm very grateful. Okay, I'm also thankful for MAHSA University to give an opportunity to be a speaker for this webinar. Okay, my topic for today is exploring modality in medical imaging, innovation and application. So before we start, there is this table of content that will be covered in this webinar. We will start with objective to understand the basic principle and mechanism of various medical imaging modality. And then second objective, identify and recognize the clinical application and benefit of each imaging modality. And the third objective, to learn about emerging technologies and advancement in medical imaging. So before we start, this is my introduction. So medical imaging has become an indispensable tools in modern healthcare, allowing for the non-invasive visualization of human body, internal structure and function. So the importance of this imaging modality lies in the ability to provide detailed and accurate information about the body anatomy and physiological processes. Moreover, recent technology innovation have further enhanced the capability of this modality, enabling more precise and comprehensive assessment. So these advancements have led to better diagnostic accuracy, earlier detection of diseases, and improved patient outcome. Okay, so we will see the modality overview. Medical imaging, it comprises a wide range of modality, each with its unique principles, strength, and application. The most common used modality include X-ray imaging, computed tomography or CT scan, magnetic resonance imaging, MRI, ultrasound, nuclear medicine, PET and SPECT, mammography and fluoroscopy. So this advancement has improved the diagnostic medicine, enabling earlier detection, more accurate diagnosis and improved treatment planning, ultimately leading a better patient outcome. So this will give an explore of various modalities in medical imaging, the innovation that have transformed the field and the practical application that continue to shape the patient care. So the key imaging modality, we will start with X-ray imaging, fluoroscopy, computed tomography, magnetic resonance imaging, ultrasound, mammography and nuclear medicine. Okay, so before we go further, we will start with history of medical imaging modality. We start with X-ray in 1895, discovered by William Conrad Röntgen, discovered the X-ray in 1895, earning him the first Nobel Prize in Physics in 1901. So X-ray becoming the first imaging modality allowing the non-invasive visualization of bone and other dense structure within the body. So this will give impact on identify fracture, tumors and lung disease. Next will be the fluoroscopy in 1896, developed by Thomas Edison. Developed fluoroscopy in 1896, which allow real-time imaging using X-ray. So this technology enabled the visualization of moving internal structure such as the digestive system. Application for fluoroscopy used for barium swallow, cardiac catheterization and placement of medical device. And after that, they will have computed tomography in 1972. This scientists developed the first CT scanner, which enable X-ray image taken from different angle to produce cross-sectional image of the body. And the CT imaging provide detailed image of soft tissue, organ and bone, leading to improvement diagnosis and treatment planning. So ultrasound, history of ultrasound in 1940 to 1950. This one developed during World War II. Okay, and the function of ultrasound use high frequency sound wave to create image of internal organ, tissue and blood flow. It is what used in obstetric, cardiology and abdominal imaging. After ultrasound, we have the magnetic resonance imaging, and the development will be in 1970 by this Raymond Damian and Paul Duterberg. Developed in early 90s, the technique used strong magnetic field and radio wave to generate detailed image of soft tissue. It will give more detail on soft tissue, abnormality, offer superior contrast resolution without ionizing radiation. And next will be the nuclear medicine in 1950. This one include positron emission tomography, PET, and single photon emission computed tomography in 1980s. So these modalities are used a small amount of radioactive material to diagnose and evaluate condition, especially in oncology, cardiology, and neurology. So we will start with X-ray imaging. A general X-ray machine is widely used medical device that play a crucial role in diagnosing a variety of health conditions. It is one of most fundamental and versatile image tool in modern medicine, providing a non-invasive method for visualizing the internal structure of the body. X-ray machines have been in use for over a century and continues to be an essential part of diagnostic radiology. So this is the basic imaging unit of the X-ray machine. We have the X-ray tube, tube column, X-ray generator, bucket tray, tabletop, and upright unit. Okay, so the X-ray tube that will provide X-ray, okay, contain filament, and it will produce the electron stream towards the anode. Bucket tray is primary purpose to hold and support the imaging receptor. Tabletop will support the patient during the X-ray procedure. So generator is provide a high voltage required to accelerate the electron from the cathode to anode, and it will produce the X-ray production. Okay, we have tube column. The tube column hold the X-ray tube in place, ensuring its security position during imaging procedure. And thus we have the erect bucket is a key component in radiology, particularly in chest X-ray and other sending of upright imaging procedure. So the principle of X-ray imaging, X-ray machine, the process began with the generation of X-ray in the X-ray tube, and it will pass through the colorimeter, which shape the beam to target of the area. The X-ray that penetrate the body and strike the detector on the other side, and then we have the detector that capture the attenuate X-ray, and then they will process the image to form the image. The image will be displayed on the monitor for immediate analysis of the medical professional. Function of general X-ray machine, a primary function of X-ray machine is to produce image of internal structure. X-ray will pass and then it will be absorbed and then they will produce image. Okay, bone being dense, absorbed by X-ray and appear white on the image, while soft tissue absorb pure X-ray and appear a shade of gray. Air-filled space such as lung absorb least amount of X-ray and they will be appear black in the image. And here is clinical application and benefit of each imaging modality. For X-ray imaging, there will be some part of it is scatter imaging, chest imaging, abdominal imaging, and dental. So we can see can identify and assessing bone fracture, bone degenerative disease, spinal condition. For chest imaging, we can see pneumonia, infection, pulmonary condition. For identify such diseases like chronic obstruction, pulmonary disease, and lung cancer. Heart and mediastinum, we can evaluate heart size and shape, detecting condition like cardiomegaly and assessing medical masses. For abdominal imaging, X-ray can help in see the bowel obstruction, detecting intestinal blockage, perforation and abdominal gas pattern, kidney stone, foreign body, and for dental, this X-ray imaging will help in the caries detection, bone loss, and tooth alignment. Gastrointestinal tract, we have the barium study why we give the contrast to the patient so that we can enhance certain part of the patient, barium swallow, barium enema, to assess structural abnormalities, masses in the esophagus, identify severe constipation or fecal infection, cardiovascular system, cardiac enlargement, and vascular calcification. Soft tissue evaluation, and we can see a detecting calcification in soft tissue masses of other abnormalities. For orthopedic and surgery planning, we have pre-operative planning, assessing bone structure, post-operating follow-up, monitoring the positioning and healing bone after surgery. So type of X-ray imaging detector, this one is the most important component that will produce the image. Before we have the digital, we have the conventional that use film and cassette. Okay, because of the advancement and development, they are changing to computer radiography, whereby it will change the conventional film cassette to digital. Computer radiography is a digital imaging process that uses special type of imaging plate coated with photo-soluble phosphor instead of traditional X-ray film. Okay, the use of this one is converted the conventional to digital image. And then we have the newest one is digital radiography system or DR, use digital detector to capture X-ray image which have been displayed and the computer system. This emit the needs for film and allow immediate viewing and processing of, and it will be reducing time consuming, okay, during X-ray imaging. Okay, this is the flow system or digital radiography system whereby the receptor radiographer need to put the patient positioning, and then when the image will be transferred to with imaging processor by the image management system, whereby you can sending through with image management system to display, and then you can put in the software or network. So next modality is fluoroscopy. So fluoroscopy is a vital image technique in modern medicine, providing real-time visualization of internal organ, tissue, and body function. Unlike static imaging modalities such as X-ray, fluoroscopy allows healthcare professionals to observe dynamic processes and make it an indispensable tools in both diagnostic and therapeutic procedure. We will explore the principal component, application, and significance of fluoroscopy in medical practice. So this is component of fluoroscopy, whereby we have the X-ray flat panel detector that capture X-ray passing through the patient. We will start with X-ray panel. X-ray flat panel detector will emit X-ray from the X-ray tube, and then we will move to the X-ray tube assembly, will emit the X-ray beam to the appropriate area. And then the X-ray flat panel detector will capture X-ray that passing through the patient, and then there will be process of this detected data into the image will reduce noise, and there will be a display or monitor that will help in the real-time procedure. So type of fluoroscopy, there will be standard fixed fluoroscopy, typically used in radiology department for general diagnostic procedure. We have cath lab, or cardiac catheterization lab. It's a specialized system used in cardiology for imaging the heart and blood vessel during catheter-based procedure. And this last one is interventional radiology unit used for minimal invasive procedure guided by imaging such as angioplasty or stent placement. We have another mobile fluoroscopy. We have C-arm machine. They are portable and flexible system often used in operating room. They can be moved around the patient and provide real-time imaging during surgeries, especially orthopedic and vascular procedure. So mini C-arm, smaller version of standard C-arm, primarily used in orthopedic and extremity surgeries where detailed image of small area is needed. Okay, so this is the example of mobile fluoroscopy with the C-arm, control panel, II or flat panel detector, dual monitor display, and also generator to generate the X-ray. And clinical application and benefit of each imaging modality. Fluoroscopy, they also have a lot of application. We have gastrointestinal tract where we can see the barium swallow, life process, okay, upper GI series, barium enema to examine the colon and rectum for the polyps, tumor, and inflammatory bowel disease. Okay, and we have a cardiac procedure, live viewing of cardiac catheterization, visualizing coronary artery during angiography to diagnose and treat condition like coronary artery blockage aneurysm, pacemaker implant, and valvuloplasty. Okay, with musculoskeletal system, we can see joint injection and arthrography, guided needle placement for steroid injection or contrast injection into joint, fracture reduction. For vascular system, we have the angiography, visualizing blood vessel in various parts of the body to detect blockage, aneurysm, or vascular malformation. Urinary tract infection, we have the voiding BCUG, assessing the bladder and urethra during the urination to diagnose vasochoroidal reflux, uterus restriction, and other tract abnormality. Retrograde paleography, visual the urethra and renal pelvis of stone, strictures, and tumor. Pulmonary system, we can see the life of visualizing the airways during procedure with biopsy and foreign body removal. Okay, reproductive system, we have HSG, evaluating the fallopian tube and uterus for blockage, addition, and other causes of infertility. Guided biopsy, assisting the obtaining tissue sample for reproductive system. And we have a guided biopsy and intervention like to see the tumor biopsy and abscess of drainage. Orthopedic procedure, we have a spinal infection and vertebroplasty. Is a guided injection of semen into vertebra to stabilize compression fracture. For neurology procedure, we can see the visualizing the spinal cord and nerve root using contrast material to diagnose hernia, spinal stenosis, or tumor. Okay, and cerebral angiography, visualizing the blood vessel in the brain to detect aneurysm, arteriovenous malformation, and stenosis. Surgical application, laparoscopic surgery, okay, guided the removal of gallbladder during surgery, and particularly when stone are present. Imaging medicine, foreign body removal, guided the removal of foreign object from various body cavities such as esophagus, airways, or rectum. Emergency vascular access, assisting the placement of central nervous catheter in the critical ill patient. So we move to our next modality is computed tomography or CT scan. This modality will have much more application, okay, in detecting the diseases. Computed tomography or computed is a powerful imaging modality widely used across various medical fields due to its ability to provide detailed cross-section image of the body. The purpose of CT scan is to provide detailed image of internal organ, bone, soft tissue, and blood vessel. It uses the imaging technique that combine multiple X-ray image taken from different angles. 3D image provide cross-sectional image slices that can be resembled into 3D view, diagnosing conditions like tumor, infection, and bone fracture. Guiding procedures such as surgery or biopsies, monitoring disease, and assessing treatment effectiveness. So this is the component of CT scan. We have the gantry and we have the X-ray and the detector, and we have table, and then they have contrapanel and viewing area. Okay, so component we have the X-ray tube but this one is with the gantry. Okay, we have the X-ray tube. When we need to have an X-ray, it generate an X-ray beam that pass through the patient, and we have the detector, but this detector are ring type. Okay, position opposite the X-ray tube with a gantry, they capture X-ray that pass through the patient and convert them into electrical signal. So modern CT scanner are solid state detector, often made of material like cadmium tungstate and ceramic cylinder that are very high sensitivity and provide rapid response time. So the gantry is the large donut shaped structure that houses the main component of CT scanner. They surround the patient and contain X-ray tube, detector, and data acquisition system. The gantry can tilter to accommodate angle scan and is typically adjustable to fit different body size. And it also include collimator. They are devices that shape and restrict the width of the beam to focus it on the area of interest, reducing radiation exposure and enhance image resolution. We have table for to put the patient, and then they will need a computer system that will control operation of X-ray tube, detector, and table move. And this one, the computer system will have the complex algorithm to perform image reconstruction, such as filter back projection or alternative reconstruction, and create cross-sectional image from the accurate data. Okay, so physics of CT, X-ray apply in circular motion with detector on the opposite side of the body. So body tissue slice, typically 1 cm, mathematically reconstruct and display on the grayscale metric. The density of the tissue is proportional to the attenuation of X-ray which pass through. So tissue like air and water have little attenuation and display as white density or dark, while bone high attenuation as is displayed at high density brightness on the CT. Among pathologic conditions, high density lesions are often seen like fresh coated blood, hypothermia, and with the use of contrast. Low density lesions include edema and necrosis. And this is the clinical application of CT scan. Okay, we can see that in neurology, rapid identification of ischemic or hemorrhage stroke to guide emergency treatment, brain tumor detection, characterization, monitoring, okay, traumatic brain injury, evaluation of head trauma, skull fracture, intracranial hemorrhage, and contusion. Hydrocephalus, assessing ventricular size and identify cause of cerebrospinal fluid accumulation. For cardiology, we can see that coronary artery disease can be detected, cardiac morphology, evaluating heart chamber, pulse, and congenital heart defect, aortic aneurysm, pulmonary embolism, CT pulmonary angiography for detecting blood clot in the pulmonary arteries. Oncology, there will be tumor staging. Okay. Radiation therapy planning, creating detailed map of tumor to guide radiation therapy, and assessing the spread of cancer to lymph node, bone, and other organ. And trauma, we can see that it helps in polytrauma assessment, spinal injury, and facial trauma, detailed image of facial bone to assess fracture and soft tissue injuries. Abdomen, we will see that there will be diagnostic acute appendicitis, liver disease, pancreatitis, kidney stone with the abdominal imaging area. Okay, and pulmonary, we have here lung cancer screening, pulmonary nodes, intestinal lung disease. Okay, next modality will be magnetic resonance imaging or MRI. So magnetic resonance imaging is a medical imaging technique that uses strong magnetic field, radio wave, and computer technology to provide detailed image on the organ and tissue within the body. Unlike the imaging modalities such as X-ray or CT, MRI does not use ionizing radiation, making it a safer option for many patients. The versatility and high resolution imaging capabilities of MRI have made it an indispensable tool in the modern medicine. Okay, so the principle of magnetic resonance imaging, we are using high magnet field. Okay, MRI operates on the principle of nuclear magnetic resonance, with the patient is placed within a powerful magnetic field which align the proton in the hydrogen atom of the body water molecule. Radio frequency pulses are then applied, temporarily disturbing the alignment. As the proton return to their original alignment, they emit signals that are detected by the MRI machine. Okay. These signals are then processed by the computer to generate X-ray of the body internal structure. The ability of MRI to differentiate between different type of tissue in one of its key strengths. Tissue will be different water content and molecule composition produce distant signal, allowing MRI to generate image with exceptional contrast. This makes it particularly used for imaging soft tissue such as brain, muscle, heart, and joint. Okay, so this is the component inside the magnetic resonance imaging. We have the magnet, we have the gradient coil, we have the radio frequency coil, we have the board and the table. Okay, so main component of MRI is the magnet. Most critical component usually a superconducting magnet generate a strong and stable magnetic field and measure in Tesla. Typical MRI machine operate at 1.5 or 3 Tesla. Through some specialization system, they can up to 7 Tesla or much more higher. So the main magnetic align the proton in the body to uniform direction. Next is a magnetic cooling system. Since superconducting magnet must be very low temperature using liquid helium to maintain superconductivity, a cooling system is required to ensure the magnet remain at optimal operation temperature. So we have the gradient coil, gradient magnet. There are three set of coil, each one of X, Y, and Z axis that creates small variation in the magnetic field. This variation of the MRI system to specially encode the position of the proton, enabling the creation of image in different plane, axial, coronal, and sagittal. So gradient amplifier, these provide the power necessary to the gradient coil, ensuring the precise control over the magnetic field gradient which are critical for image resolution and quality. Component of MRI, there will be transmit radio frequency coil. This coil emit the radio frequency pulse of the lambda frequency, the resonant frequency of hydrogen photon in magnetic field. This pulse disturbing the alignment of photon, causing them to emit signal that return their original state. So receiving RF coil, this coils detect the weak signal emitted by the photon. A proton as they relate back to their aligned state. The signal are then sent to the computer system for processing into image. RF coil can be designed for specific body part like head, spine, and knee to optimize signal reception. And we have the RF shielding. The MRI room is typically shielded with copper or similar material to prevent external radio frequency interference, ensuring the accurate of MRI system. So computer system for MRI, they will be process the image to do the reconstruction. There will be control software where the software manage to entire scanning process, protocol adjustment, adjusting image parameters, and performing image reconstruction. And there will be a data storage. The system store the accurate image and patient data, which can be accessed later for analysis, comparison, and sharing with other healthcare provider. Okay, there were type of MRI. We have closed-bore MRI machine, open-bore MRI machine, and dedicated MRI machine. Okay. Technology advancement of this MRI technology, closed-bore, high magnetic field strength produce better image. Reduce bore length of patient comfort. The bore diameter can be expanded to 7 cm. Open bore MRI, the open design with 2 flat magnets stacked vertically. Acoustic noise from the MRI machine is reduced. Specialized cardiac MRI technique for left and right with ventricular shape, function, and tissue characterization. Specialized breast coil and imaging protocol optimized for breast imaging. And there will be a clinical application and benefit of each imaging modality. There will be neurology. We can see brain imaging, MRI is the gold standard for imaging the brain. It's used to diagnose and monitor conditions such as brain tumor, stroke, multiple sclerosis, aneurysm, and traumatic brain injury. And here is spinal cord imaging. MRI is essential for evaluating the spinal cord and surrounding structure. It is used to diagnose conditions like herniated disc, spinal tumor, spinal cord compression, and degenerative disease. Functional MRI used to map brain activity by detecting change in blood flow. It often employs a pre-surgical planning to identify critical area of the brain responsible for functions such as speech, movement, and sensation. Musculoskeletal imaging, joint and soft tissue evaluation. MRI provide detailed image of joint, muscle, ligament, and tendons, making it vulnerable for the spot injuries, arthritis, and ligament injury. Bone and marrow disorder. MRI can detect bone infection, tumor, fracture, and bone marrow abnormalities. It is particularly used in evaluating bone tumor and conditions like osteomyelitis. Cardiology, cardiac imaging, provide detailed image of heart structure and function. It is used to evaluate congenital heart defect, cardiomyopathies, myocardial infection, heart valve disease, and pericardial condition. Bone marrow disorder, MRI can detect bone infection, tumor, fracture, and bone marrow abnormalities. It is particularly used in evaluating bone tumor condition like osteomyelitis. Okay. Vascular imaging to assess blood flow, including arteries and veins, for conditions such as aneurysm, dissection, atherosclerosis, venous thrombosis. It provides a non-invasive alternative to angiography. Oncology, tumor detection and characterization is high sensitive for detecting tumor in various organs, including brain, spine, liver, pancreas, kidney, and prostate. It provides detailed information on tumor size, location, and extent, help in staging of treatment planning. Breast MRI used for breast cancer screening in high-risk women, evaluating the extent of breast cancer and assessing the response to the treatment. It is particularly useful in detecting cancer that are not available in mammo, especially in dense breast tissue. So we move to next machine, modality, ultrasound. So ultrasound is a type imaging technology that use high-frequency sound wave to provide image of structure within the body. It is commonly used in medical setting for diagnostic purpose, such as monitoring a fetus during pregnancy, examining organ like the liver or heart, and assessing blood flow through vessel. So ultrasound is an imaging test that use sound wave in order to produce picture of the organ, tissue, and other structure inside our body, also known as ultrasonography. It involves transducer probe, central processing unit, beamformer, pulsar, receiver, control, image processor, and display. Okay, so there are types of ultrasound. We have 2D ultrasound. Traditional ultrasound produce flat two-dimensional image, and then there will be advancement of this ultrasound to 3D ultrasound, capture more detailed three-dimensional image. 4D, similar to 3D but capture more movement, often used to filter imaging to see real-time motion. Doppler ultrasound measure blood flow and movement, useful for detecting issues like blockage or blood clot. Okay, so this is basic component and function. We have the display, we have transducer, pass control, keyboard, CPU, disk storage, and printer. Okay, we have transducer probe, responsible for sending and receiving the sound wave that create image. Central processing unit, act as the brain of ultrasound, process and interpret the probe optical signal. Pass control, change amplitude, frequency, and duration of pulses emit from the transducer probe. Beam former, focus and direct the beam to form a coherent image, control the beam, shape, direction, and scanning pattern. Pulsar or receiver, generate electrical pulses that drive the transducer to emit sound wave. Receiver will be amplified and processes the returning echoes from the body. Control, keyboard and control to enter patient data and adjust the imaging parameter. Image processor, filter, compress, and image enhancement, enable real-time imaging. And the display present the image on the computer monitor. Clinical application and benefit of each imaging modality. We have the obstetric and gynecology for fetal imaging. You can monitor fetal development, checking baby position, assessing amniotic fluid, help detecting congenital abnormality, determining the baby sex, and monitoring the growth. Pelvic examination, it can use to evaluate condition like ovarian cyst, fibroid, and other abnormality in female reproductive system. Cardiology, the echocardiography, the specialized ultrasound evaluate the heart structure and function. It can detect heart valve abnormalities, congenital heart defect, and assessing the heart pump efficiency or ejecting fraction. Stress echocardiography combines echocardiography with exercise or medication to assess how the heart function under stress, useful in diagnosing coronary artery disease. Okay. Vascular ultrasound, Doppler ultrasound, the technique assess blood flow in arteries and vein. It used to detect blockage, blood clot, and assess condition like peripheral artery, PAD. Carotid ultrasound with the carotid arteries in the neck to assess the risk of stroke by detecting plaque build up or narrowing the arteries. Breast ultrasound or breast magic used to adjust to mammography to evaluate breast lump or other abnormalities. It helps in differentiating between cysts and solid mass and guided needle biopsy. Okay. Next modality will be mammography. Okay. Mammography is a special radiographic technique which create an image of the breast on an X-ray film. It illustrates the breast tissue which consists of glandular fibrous and adipose tissue or fatty tissue, blood and lymph vessel. So mammography is vital for the early diagnosis of breast disease and breast cancer. So this is the component of the mammography machine. We have the X-ray tube, we have compression device, cassette holder or breast support table, automatic exposure device position control, automatic release foot pedal, and then there will be angulation of indicator scale. So they can move the angulation of certain angle. Okay. We have the X-ray tube, but the X-ray that produced for mammography, they will be much more lower energy level, between 25 to 35 kVp compared to other X-ray procedure, which is optimal for imaging soft tissue. We have the compression mechanism. It's the essential part of the mammography system, responsible for applying each pressure on the breast to spread out the tissue, reduce thickness, and minimize motion. This step is crucial for obtaining clear image and reducing radiation exposure. Imaging receptor, film or digital detector. Traditional mammography use film-based detector, but most modern system use digital detector that allow for the better image manipulation, storage, and analysis. Mammography also have generator. This generator will support the necessity electrical power to produce X-ray. Control the energy and timing of X-ray production, which are critical for optimizing image quality while minimizing radiation dose. Control panel, radiographic technology set the exposure parameter, including X-ray energy, exposure time, and compression force. Modern system may have automatic setting that optimize this parameter based on the breast tissue density. We have for digital, we have viewing and archiving system or PAC. Picture archiving and communication system. You can keep, you can transfer, it will be much more faster. Imaging process system, we have analog, film based, but most of nowadays mammography is being converted to digital. Image are processed by software that are can adjust contrast, brightness, and other parameters to enhance visualization of breast tissue. Digital image can also be easily stored, shared, and analyzed using CAD, computer-aided detection system. Okay. Clinical application and benefit of each imaging modality. We have the breast cancer screening. Routine screening, mammography is the most effective tool for routine screening to detect breast cancer in asymptomatic women. It is recommended for women starting of the age of 40 to 50, depending on guideline, and is usually performed annually or biennially. Okay, early detection, regular mammogram can detect small tumor or microcalcification that may not be palpable during physical examination. Early detection through screening mammography significantly improve the chance of successful treatment or survival. Okay. Diagnostic mammography, follow-up of abdomen screen result. Um, screening mammography show a suspicious area. A diagnostic mammo is performed to get more detailed evaluation. These involve additional views and magnified image to better characterize the abnormality. Evaluation of breast symptom, diagnostic mammography is used to investigate specific breast complaints such as lump, pain, nipple discharge, or change in the breast shape. It helps in determine whether these symptoms are caused by benign condition or cancer. Monitoring known abnormality for women with non-breast abnormality such as benign lump or post-surgical change. Diagnostic mammography is used to monitor for any change over time. Okay. Next modality is nuclear medicine. Okay. So nuclear medicine is a branch of medical imaging that use small amount of radioactive material known as radiopharmaceutical to diagnose and treat various diseases. This field uniquely combine elements of chemistry, physics, biology, and medicine to visualize the physiological function of the body, making it distinct from other imaging modality. Nuclear medicine involves various techniques and procedures, all of which use radiopharmaceutical to diagnose and treat disease. Here are some of the most common type of nuclear medicine. We have a SPECT scan and PET scan. SPECT with single photon emission computed tomography scan and PET positron emission tomography scan. Okay. Physical process involved in the formation, attenuation, correction can be performed by two methods. A main physical processing occur absorption and scattering. Some of the gamma are absorbed by tissue. Impact the sensitivity of the scan. Rays originated from deeper region are attenuated more. Calculated attenuation correction. Take into account tissue thickness and tissue attenuation coefficient. Transmission attenuation correction. Use a transmission image of patient taken from the external gamma source or CT scan. So basic component of SPECT scanner, we have gamma camera, capture the gamma rays emitted by the radio tracer. Gantry of the gamma camera, it allows the camera to rotate around the patient. Computer system process the signal from the gamma camera, reconstruct the 2D into 3D representation. Collimator is a device fitted to the gamma camera. It filters out photons that are not travel in the desired direction. Injective system includes shrink or automated system that ensure the correct dose of the radioactive tracer is administered. Okay. Basic component function, data reconstruct in 3D. Involve two methods. Detector gamma. Gamma camera detection are utilized a number of gamma camera range from 1 to 4. Okay, basic component function of PET. This one is source of energy. A liquid radioactive material is injected into body. The proton rich nucleolide emit positron. Okay, we have the detector. Features a ring detector inside. Image reconnaissance system. A computer analyze those gamma rays. Use the information to create an image map of the organ or tissue being studied. The amount of radionuclide collected in tissue affect how bright the tissue appear on the image and indicate level tissue function. PET data are displayed at transverse, sagittal, and coronal slice. So clinical application for nuclear medicine, we have bone scintigraphy. We will see the bone scintigraphy involve the use of radiopharmaceutical, commonly technetium-99m, that is absorbed by the bone, a gamma camera that capture image of the skeletal system. This application is to detect bone metastasis, fracture, infection, and other bone disorder, and is very useful in oncology. Okay. Next is a clinical application of nuclear medicine, steroid scintigraphy. The radiopharmaceutical use either iodine 123 or technetium-99m to evaluate and function of structure of thyroid. This can help diagnose conditions like hypothyroidism, thyroid nodules, and thyroid cancer. It also used to assess the effectiveness of thyroid treatment. Myocardial perfusion imaging, MPI is a type of nuclear cardiology procedure that use radiopharmaceutical like thallium-201 and technetium-99m to access blood flow to heart muscle or myocardium. This test is used to diagnose coronary artery disease, evaluate the severity of blockage, and determine the effectiveness of treatment like angioplasty and bypass surgery. Renal scintigraphy or renal scan, it also the radiopharmaceutical such as technetium-99m, DTPA, and MAG3 to assess kidney function and urinary tract structure. It used to evaluate kidney function, detect obstruction in urinary tract, measure renal perfusion, and access condition like hydronephrosis or kidney transplant viability. Okay, we have covered the modality. Now we proceed to imaging technologies with digital tomosynthesis, molecular imaging, hybrid imaging technique, PET, PET-CT, PET-MRI, and artificial intelligence in medical imaging. Okay, digital tomosynthesis. Digital tomosynthesis is a molecular imaging, is specialized technique used in medical imaging that allow for visualization, characterization, and measurement of biological process at the molecular and cellular level in living organism. Unlike traditional imaging method, they primarily show the structure of tissue and organ. Molecular image provide insight into function and activity of specific molecule within the body, often related to disease processes. Image acquisition, the X-ray source move along a specific path, okay, around the object, capturing a series of low dose image of different angle. Reconstruction, the acquired image are processed using computer algorithm to reconstruct slice image of the object of various depth. This allows for the visualization of structure within the object layer by layer. And viewing the reconstruct slice can be viewed individually or combined to create a 3D representation of the object. Okay. Clinical application of digital tomosynthesis, we have this breast imaging, screening and diagnosis. Digital breast tomosynthesis or DBT is commonly used in mammography for breast cancer screening. It improves the detection of small tumor, especially in women with dense breast tissue, by reducing the overlap of tissue that can obstruct lesion in traditional 2D mammo. So DBT reduces the need for additional imaging, providing clearer image and reducing the lack of false positive. Chest imaging, lung nodule detection. Tomosynthesis used to chest imaging to detect lung nodules, particularly in patients at risk of lung cancer. Often better visualization of lung, parenchyma and other structure compared to traditional chest X-ray. It can be used to assess patients with interstitial lung disease by providing clear image of the lung field and reducing the overlap of anatomical structure. Okay. In orthopedic, digital tomosynthesis used to detect complex fracture that may not visible on standard X-ray, especially in area with like wrist, spine, and hip. Okay. It also useful in evaluating joint conditions such as osteoarthritis by providing detailed image of the joint spaces. Okay. Molecular imaging, specialized technique use medical imaging to allow for visualization, characterization, and measurement of biochemical process of molecule and soluble in the living organism. There will be unlike traditional imaging method that primarily show the structure, molecular imaging provide insight into function and activity of specific molecule within the body, often related to disease processes. Okay, we have PET-CT scan. It's a combination of PET scan for more sophisticated and detailing medical result. Example, cancer. PET use mild radioactive tracer to see abnormal cell activity. CT use X-ray to provide 3D image of the organ. So combination of these two modality, it will provide detailed image by showing both anatomy and physiology of the patient body. Okay. Both PET and CT, we have the PET, we have the gantry, ring shape, housing of the component that necessary to provide detection radiation. Got scintillation detector ring, detect gamma emitted from radioactive tracer, and electronic acquisition system site that detect the signal from detector, processes the signal to be imaged. CT, we have the X-ray tube, produce X-ray photon, ring shape, house X-ray tube and detector. Detector detect X-ray and construct cross-sectional image of sun. Okay, so PET CT component, we have patient bed, we have a combined gantry, integrated PET and CT component for seamless transition patient. We have a radiation shielding, protect patient from unnecessary exposure. Cooling system ensure the machine operate with the safe temperature without overheating. PET MRI, combination PET and MRI, integrate two modality function into one machine. PET that review the metabolic and anatomical information. MRI show the soft tissue contrast. Doctor can comprehend the physiological process better. Okay, so PET MRI component, we have the gantry, reshape, housing all the component that necessary to provide detect radiation, acquisition system, site the detect the signal from detector and process the signal to be imaged, coupled with the photo multiple tube and detect the gamma rays produced. So MRI, we have the magnet, superconducting magnet, gradient coil, creating varying magnet field to allow spatial encoding, radio frequency coil for transmit radio frequency pulse, computer system process receiving signal. Patient bed to support the patient, and cooling system ensure PET and MRI function in safe temperature, and shielding to minimize interference between the PET and MRI component. Okay, our next is artificial intelligence or AI. So artificial intelligence is revolutionizing medical imaging by enhance the accuracy, efficiency, and accessibility of diagnostic procedure. The interaction of AI into the field, machine learning algorithm, deep learning technique, and advancement data analytics to improve the interpretation of medical image, automate routine tasks, and support clinical decision making. AI will also transform the workflow in radiology department by automating routine tasks such as segmenting organ or measurement value. AI allow radiologists to focus on more complex cases. AI can prioritize urgent case, ensuring critical finding like a brain hemorrhage or pulmonary embolism flagged and review immediately. These are significantly reduce the time to diagnose and improve patient outcome. Okay, this is the example of artificial intelligence or AI. Image acquisition with image processors, and then AI will analyze, image analyze, and then there will be diagnosis and prognosis. Okay, it helps radiologists to have much more faster result detecting the diseases. So AI can assist in detect tumor, fracture, and other abnormality with high precision. In mammography, AI tools have been developed to identify early signs of breast cancer, sometimes with greater accuracy than human radiologists. Similarly, in dermatology, AI-powered image analysis and classify skin lesion and differentiate between benign and malignant condition. Okay, future direction. The future of medical imaging holds exciting possibility with ongoing research and development. Innovations such as portable image device, advancement contrast agent, and improved technique promise to enhance diagnostic accuracy and patient care. Integration of big data and machine learning into imaging system will revolutionize image analysis and interpretation, paving the way of personalized medicine and better healthcare delivery. As the conclusion for my webinar, the continuous evolution of medical imaging modality is revolutionizing healthcare by providing clinicians with ever more precise, detailed, and comprehensive view of human body. These innovations are not only enhanced diagnostic accuracy, but also enabling more personalized and effective treatment strategy. As technology advances, the integration of AI, hybrid imaging system, and new modality like photon cutting CT will further push the boundary of what is possible in medical imaging, leading to better patient outcome and deeper understanding of human and disease. For that, I will conclude my webinar. And this is my reference, and thank you for your attention.
All right, thank you, Madam Umi Sarah, for very insightful and deep presentation. Dear viewers, if you have any question for Madam Umi Sarah regarding the topics today, please leave the comment below. Okay, and also please fill in the survey form which can be found at the comment section by the end of this webinar. E-cert will be awarded. So we are waiting for the questions now. If you have any questions, so please don't be shy to leave your question in the comment section. Okay, while waiting for the questions, okay, Madam Misara, how do you feel about today's topic? Is it really close to your specialty or something?
It's a very interesting topic. It's a very interesting topic. It's a light summary of the modality that have been used in medical imaging, and there will be lots of information. Okay.
Okay, I see. Okay, Madam Umi Sarah. So now we have a question from Fatin Jabbar. Okay, she asked, is there any available AI for mammogram?
Okay, thank you for asking question, Ms. Fatin Jabbar. Is there any available AI for memo? I think the AI have been being adapt to the medical imaging. Okay, they are already have AI for memo because this AI or artificial intelligence will help the radiologists to get more better precise decision on diseases and detecting the stages of the breast cancer or screening. Okay, it help patient to understand more regarding their diseases. AI.
Right. All right. Thank you, Medumi. So I see that there is presence of AI to in the mammogram in detection of breast cancer. All right. So next, is there any question? Okay. Question from Azim Omar. He asked, is that in PET scan, will there be any tissue damage due to radioactive material? Medumi?
Thank you for the question, Azim. As you know that there will be a radioactive material being used in PET scan. Okay, but the measurement that have been used in PET scan it's already been researched, and there will be a component that will be controlling the tissue damage. Okay, so it will be very safe to the patient. Okay, there will be allocate area for that using PET scan. They have their own rooms so that they are not affected other people. Okay, and the research have shown that when you go through the PET scan, basically it will be minimal, okay, tissue damage due to the radioactive material. It help more on diagnosing the diseases, more benefit. The risk there, but it will be less risk. It will be already safe for the use.
All right. Thank you, Madam Umi. Hopefully, Madam Umi answer will give a little bit answering the concern from the Azim Omar. Okay, next we have another question from Miss Ainu Fadlin Osman. Okay, she asked that how would the AI technology affect the healthcare system in Malaysia? Right.
Thank you, Miss Ainul. Regarding this question, okay, how the AI affect the healthcare. I think because we are in the modern world, and AI is one part of our use now. Okay, so AI is a computer that will manage all the data, and it will be helping the radiologists and other physicians to understand and help in give accurate information. Okay, uh, our ability is not as big as the computer that can analyze, and it help in getting what is the best, okay, for the patient. Okay, we didn't see that it will reduce the responsibility of physician, but help it help the patient and also the physician.
Okay, so means that AI technology is shaping healthcare system in Malaysia toward the productive and effective services. Okay, we have the fourth question from Abida Parvin. Okay, this viewer asks that if patient in third stage, any prognosis? I think that is that if the patient in the third stage of certain medical condition, is that any prognosis can be used, can be what we call can be outlined using the medical imaging modality.
Thank you for the question. The third stage or any prognosis, because medical imaging have a lot of modality. Okay, it will start with the lower X-ray imaging, and then they will have the fluoroscopy, CT scan, MRI. Okay, if the patient have been diagnosed to, for example, cancer, okay, we need to have a few modality, okay, to help the patient to understand, is it what is the requirement. Okay, is it for we need to do a chemotherapy or radiation therapy or treatment planning? Okay, we cannot say this is the. We need to see the change that step. Okay, it's not only one modality. Maybe it will be added. For example, start with CT and then MRI and then nuclear med, because we want to see what happened to this patient with the third stage. We cannot say, okay, this confirmed. So we need to have a further investigation on that diseases.
Okay.
Okay,
So
answer the question.
hopefully, we have another question from Kari. Okay, AI able to pick up early stage cancer cell, Madam Umi. Okay.
Okay, thank you, Miss Reka. Okay, AI, we still need to have AI is a supporting system, okay, that will help radiologists to understand, is it meaning you cannot apa depend on one component. Okay, maybe we need to have a further investigation on to, meaning we need to have the screening first. Okay, if there is abnormality, we need to do a further investigation, take the sample, and then see the cell, is it cancer or tumor. Okay, AI, because the AI is the system that will have all the information of previous memo, and then they put up in the computer system, and they try to analyze. Okay, maybe the analyze still not enough to confirm the early stage. Okay, but it will help in the assisting the diagnosis. I hope it will be answer the question.
All right, thank you, Madam Umi. I hope all the questions already been answered by Madam Umi. So, dear viewers, if you have any other question, just leave the question in the comment section, and we'll be answering. Madam Umi will be answering the question time by time. Okay. So, I think we have come to the end of today's session. Thank you again, Medumi Sarah, for joining us today and providing such insightful information. It's very honored to have you today to listen to your sharing. It's very exciting about your sharing. And also to our wonderful audience, thank you for joining us at this webinar. We are looking forward to your comments and participation at the future events hosted by MAHSA University. So before that, please fill in the survey form, which can be found at the comment section by the end of this webinar. And also the receipt e-cert will be awarded. So in the case of any further queries, you can contact us through MAHSA website or visit our social media. So I think that's all for today. Have a pleasant day, everyone, and thank you for joining us. Thank you.